صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي اللهم إني أسألك علما نافعا رزقا طيبا وعملا متقبلا شفاء من كل داء. This is Dr. Zunaira Faiz. Today the topic of discussion is dysmenorrhea. Dysmenorrhea, also known as dysmenorrhea, that is painful periods or menstrual cramps, is pain during menstruation. Dysmenorrhea is a term describing painful menstruation that typically involves cramps caused by uterine contractions. Dysmenorrhea is divided into two categories. Number 1, primary dysmenorrhea. Number 2, secondary dysmenorrhea. Dysmenorrhea, primary, when it is, the definition is painful menstruation with no identifiable pelvic pathology. Note, the highest level is in the first 2 days of menses. This is primary dysmenorrhea. Secondary dysmenorrhea is painful menstruation due to pelvic or uterine pathology. When we go into detail about the primary dysmenorrhea, causes are, it is the increased prostaglandin production by the endometrium in an ovulatory cycle which cause contraction of the uterus. Secondary dysmenorrhea, the causes are endometriosis, adenomyosis, pelvic infection, uterine fibroids, intrauterine device, congenital uterine or vaginal anomaly. Now, in this picture, you can see endometriosis. The lesions, they are here. You can see the bluish lesion in the ovaries, and this can be anywhere around the intestine, in the pouch of Douglas, in the uterine. That is, you can see the myometrium, the perimetrium, and the abdominal cavity, fallopian tubes, and anywhere it can be in the uterine, in the pelvis. Adenomyosis. Here we can see this is the endometriotic, that is stroma glands. They are found in the myometrium of the uterus, and they are behaving like the endometrium here in the myometrium. Pelvic infection, pelvic inflammatory disease, that is inflamed uterus, you can see inflamed fallopian tubes and inflamed ovary. Uterine fibroids, within the uterus, fibroids, you can see here it is in the endometrium, myometrium, and it is in the, again you see in the fundus, fibroids. This is the fibroids, they are in the uterus. It can be in the near the endometrium, in the myometrium, and it can be attached to the perimetrium with the help of pedicle, or it is attached to the cervix also. Intrauterine device, you can see this is copper T, and here it is lying, you see its prongs, and here you can see its stump. Hormonal IUD, it is like this, that is Marina, its name is Marina, and the strings are in the vagina, and this is the source of infection. Here you can see infection can be transmitted up. Congenital uterine or the vaginal anomaly. The normal uterus, you can see here the uterine hypoplasia or agenesis. Either your uterus is small or absent uterus. And then it is in the class 1. The class 2, that is uniconvert uterus. Here you can see, and this is uterus didelphus, double uterus you can see. Here biconvert. The uterus, there are 2 cornua, and here it was 1 cornua. And here septate uterus in class 5. Class 1, 2, 3, 4 and 5 septate uterus. Here it is the septum, you can see here. Arcuate uterus, it is like this. When you cut it is like it, there is indents. It indents at the fundal level. It looks like a little bit just like as a heart, it dips down. And here class 7. Diethylstilbestrol, DES, drug related change, that is the myometrium is thickened. So these are the changes in the uterus you can see anomalies congenitally, and this is drug related. This is all the cause of secondary dysmenorrhea, that is painful menses. Dysmenorrhea symptoms: pain in the lower abdomen. It's very common. Pain may radiate to the lower back to the thighs, which are again common. Pain may be sharp pelvic pains, cramps, or the deep, dull ache is there. Primary dysmenorrhea starts from the 12 to 24 hours prior to onset of menses. Abdominal pain often accompanied by nausea, diarrhea, fatigue, lightheadedness, or headache or dizziness. Secondary dysmenorrhea usually occurs after the woman has experienced problem-free periods for some time. Pain may be unilateral, constant, and continuous longer than primary dysmenorrhea. May be painful intercourse, painful defecation, that is when she passed through, there is painful coitus also, or irregular bleeding may occur at times other than menses. So it is also related with irregular bleeding other than menses. Assessment and diagnosis: history collection. We have to take the history, physical examination. We have to do the pervaginal examination, speculum examination, general examination. Of course, you do physical examination. You will do. Primary dysmenorrhea, cramping pain with menstruation, and the physical examination is completely normal. Secondary dysmenorrhea: if the sign and symptoms are findings, then further diagnostic evaluation they are done. Laboratory test for CBC to rule out the infection, urine analysis to see the bladder infection, cervical culture to exclude the sexual transmitted infection. Nowadays it is called STDs, sexual transmitted diseases. ESR, electrolyte sedimentation rate to detect an inflammatory process. Non-invasive diagnostic procedure: abdominal and transvaginal ultrasound. It's very important. Invasive diagnostic procedure that includes the laparoscopic examination, hysteroscopy, and DNC procedure. Treatment includes the pain relief, non-steroidal anti-inflammatory drugs, for example, naproxen and ibuprofen. Low doses of the oral contraceptive pills. Heat application. Heat is applied to the lower abdomen or back may reduce dysmenorrhea. Lifestyle changes like daily exercises, it will help relieve the situation. Weight loss, smoking cessation, relaxation techniques, that is sleep and rest for adequate time. Avoid unnecessary workload. So walk is very good. Exercises, different aerobic exercises. And of course taking sleep at time, awake at time, and then rest is for adequate time is important. Midday rest, it also helps to relieve the anxiety, tension, and in turn indirectly it affects on the treatment of dysmenorrhea. Avoid unnecessary workload. This is also important. To treat secondary dysmenorrhea, management of the secondary dysmenorrhea is directed at diagnosis and treatment of underlying cause, for example, endometriosis or pelvic inflammatory disease, that is PID. Then again, adenomyosis is there, and if there is a congenital anomaly, we can surgically correct it. And all these, they are the steps to relieve the secondary dysmenorrhea. Reassurance to the patient is very important, and if she knows that there is a disease or any problem, underlying pathology is going on, to treat this pathology, it helps to relieve the dysmenorrhea psychologically also. So with that, thank you very much. I hope my lecture will help in your studies, inshallah.